with this disease and flirting with it. This is not a problem for the youth as such. We are seeing a return to normalcy even amongst health workers. These times are not normal, and please do not treat them normally. Normal behavior will have abnormal consequences. Fellow Kenyans, since we relaxed the measures, we have seen worrying trends in many of our counties. Counties like Kilifi, that had registered remarkable containment, are now back to registering high numbers of positive cases. Other counties like Nakuru, Turkana, Trans Nzoia, Kisii, Kisumu, and Bungoma are also on a worrying trajectory. The spike we are witnessing has not just erupted out of nowhere. It has in part been triggered by wanton violations of containment protocols and advice from our experts. I am told that bars are neither requiring their patrons to observe social distancing nor asking them to wear masks, and they seem to be under the impression that sanitization at the door is a sufficient requirement for service. What I find ironic, and this is a very unfortunate part, is that it is those same business people and business owners who pleaded with the president to reopen the businesses because of the hardships they were facing as a result of the closures. I plead with you to work with us in enforcing measures in order to stop the possible escalation of the restrictions. Besides, public gatherings, including burials, weddings, and even political rallies, seem to have resumed with total disregard to advice given by this ministry. Leadership is not just a position. Leadership is leading by example. If leaders do not observe the measures given going to political rallies and other gatherings, the signals that they send to the public is that all is well. Yet we know that it is not. I appeal to leaders, particularly political leaders, to show leadership at this time and model best behavior to our people in regards to COVID-19 spread and pandemic. Somebody has to take responsibility, and it must, and it will, start with political leaders, business owners, and the organizers of events that attract large crowds, that are against the protocols that we have set forth. And no matter how much we preach to Kenyans, if we, the leadership, do not lead by example, we will simply be singing a song that Kenyans will not believe. And I'm therefore, and this is the advice given by the National Emergency Response Committee today, is to appeal to our people, especially the leadership, to simply adhere to the rules that we have given. This appeal goes to many people, including political leaders who are forcing large gatherings, no idea about masks, and it is no wonder then that the kind of figures that we are seeing have gone up. Today, 685 persons have tested positive for the virus from a sample size of 4,912 in the last 24 hours. This is a positivity rate of 12%, up from around 4% when we relaxed the containment measures. Therefore, a total of 44,881 persons have now been confirmed positive in our country, with the cumulative tested persons of 621,976. 635 Kenyans are Kenyans, while 50 are female, while 50 are foreigners. 456 persons are male, while 229 are female, with the youngest being a 1-year-old baby, while the oldest is 99 years old. In terms of counties, as I had said earlier, there are some counties that are now beginning to be of concern. And you will remember that when the disease started and some counties were more heavily affected than others, we had to take measures to contain those counties, restricted movement so that people could not be able to, so that the disease can be contained without people spreading it to other counties as well. Today, NAC advised that even in those counties, that the county governments take strict measures to ensure that, number one, all the health workers there have got personal protective equipment, and this is available. Secondly, is to ensure that in social gatherings, distances are kept. Thirdly, we are asking enforcement agencies to ensure that we enforce the current containment measures, keeping in mind that responsibility for containment of the virus, as we have said many times before, lies with individuals. It is an individual responsibility to put on a mask. It is an individual responsibility to keep the distance. And it is an individual responsibility to keep on washing our hands. At this time, when our children, or some of our children, have gone back to school, this becomes even more critical and even more important, so that we do not have infection rates beginning amongst the children. Worthy of note today is that we are also witnessing high ICU cases, including in counties such as Isiolo, where there has never been an ICU case, but now we have them. Today, we have 28 cases in ICU, and closing very quickly towards 1,000 admissions in health facilities. This is not even counting those who are in home care. So, ladies and gentlemen, there is no doubt that we are witnessing what our modeling team this morning were calling a case of new infections. We are heading for a second wave without doubt. We are also witnessing higher cases from prisons and other institutions across the different counties. As mentioned earlier, there are some counties that are of concern, Nakuru being a particularly high one, and we are asking Nakuru residents to be on the lookout and to know that cases are rising rather sharply in that county. Nairobi as well is beginning to show a steep upward swing, as is Mombasa at 73 today, while in the previous days it has been much, much lower. I will be distributing the list to the media so that they can be able to inform the country, county by county, what is actually happening. We have some recoveries as well. 105 people have recovered from the disease, 73 from home-based care program, while 32 have been discharged from various hospitals. The total recoveries today stand at 31,857. Unfortunately, if you remember yesterday we lost some 12 people. Today we have lost another 7 patients with the disease, bringing our total fatalities to 832. And our sincere condolences go to the families of the bereaved. Finally, let me say this. We need to reflect on these numbers and especially the rising positive cases and deaths, if they don't mean anything to us, then please let our loved ones count, because when all else fails, it is our sacred duty to protect them. Remember, as I have said repeatedly, we cannot afford to treat this disease normally. Let us not go back to normal behavior. It will hurt us if we do go back. So please take caution and do the needful. Wear your masks. Stay at home if you can and work from there. Social distance at all times and sanitize. I want to thank the members of the Fourth Estate for your unwavering support and continuing to eliminate the status of coronavirus in the country. Sometimes we appreciate the frustration. We appreciate the fact that it is taken for granted. We have said it for so long that we believe there is possibilities of fatigue setting in. There is fatigue among the citizenry for being asked to behave in a manner that they have not been. Probably people thought it is something they were going to do for a couple of months, and then it was going to end. Sadly, I must tell my fellow Kenyans, be prepared for the long haul. This is not going to be a short-term issue. Secondly, I am also appealing to our enforcement agencies. We realize that after more than 7 months of doing the same thing, it is obviously fatiguing, and it's tiring to continue doing the same. But I must ask you that we cannot and we must not relax at this time. This is the most dangerous time for us to do so. So, fellow citizens of this country, I appeal to you, let us rededicate ourselves. The individual responsibility and the concept of individual responsibility is what made us relax the measures when the president announced them. We must not, as a result of individual irresponsibility, allow ourselves to go back and take the same measures that were there in order for us to start containing this disease once again. What happens tomorrow, whether the measures are escalated or not, depend purely on us, Kenyans. It depends on the business owners. It depends on the people in the streets. It depends on us, the political leaders. And it depends on leadership. NAC today proposed that the Interfaith Council also hold a meeting to discuss what is also beginning to happen in a lot of the churches, and so that they can also be able to advise us accordingly. Thank you, ladies and gentlemen. You can now take 1 or 2 questions.
Good afternoon. I'm Purity Museo from KBC. You rightly said that we are maybe headed to the second wave of the infections, and when you are comparing the COVID-19 with the Spanish flu, you said we might be expecting something serious than what we have experienced during the first wave of COVID-19. So when that was announced, when COVID was announced in the country back in March, we saw some measures being put in place, including closing of schools and other restriction measures that were imposed. Maybe because you just confirmed that, are we expecting any more measures, because it's more than 7 months on and social gatherings still ongoing, especially from the political leaders and other areas that you've mentioned? Are our children safe in school? There are those who've gone back to school. Are they safe there because the cases are increasing? And then question number 2, when the cases were going down, we saw not really reluctant in testing, but the testing, especially in the country, was reduced, the capacity, because of the capacity. So are you going to re-embark on mass testing, or what plan do you have to really establish the extent of this second wave of infection? And then to DG Amoth, maybe from what scientists are saying, we can talk about the severity of this pandemic, because African countries are still not struggling with the severity, still experiencing the asymptomatic type of COVID-19. Maybe that's why people are reluctant. So what is the science saying? On the deaths, so many people are dying. So how many people have died from homes and how many have died from the health facilities across the country?
Thank you, Purity.
My name is Mwangi Maina from TV 47. We have seen people who have gone back to schools, they don't have face masks. There are no facilities of washing hands and all that. And CS Rashid Aman said that we might be forced to close down schools in case the curve continue to rise. What is the ministry doing towards ensuring that our children are safe in school? Secondly, the question on the political rallies and gatherings. There are, like today, there is a rally somewhere in Embu. What is your take concerning this as a ministry? Are you disturbed? Are you concerned about this? Then the Nairobi Metropolitan Services was taking mass testing in Nairobi. We've seen not many Kenyans have turned up for the mass testing. What is your appeal to Kenyans and the virus burden we have in the country as it now? Thank you.
Thank you, Mwangi.
Sada Hassan from Standard Group. My question is on the political rallies that we're seeing in the country. Several measures have been taken by the police authority in terms of arresting Kenyans who are seen walking in town without face masks. But if we look at the political side, nothing has been done. Isn't this a contrary to what the Minister of Health is appealing? And then the second question is on mass testing that we're seeing. Are these numbers, is actually on the numbers that you presented today, are these numbers what we have today, or this is still a backlog that we were witnessing in the country last week and the other week?
Chamutai going from Citizen TV, possibly the questions that I wanted to ask have been addressed, but maybe just to give a bit of clarity. In the last about 3 days, there have been over about 70 deaths, and there's a bit of concern regarding the high number of people that are succumbing to the virus, whether it is those with pre-existing conditions or those with none. So possibly maybe DG and Waziri, you can tell us about the condition of the death and the testing capacity that we are seeing now. Today there are 4,000 samples that have been tested. Initially we had seen that the number of testing had gone down. There was a point where there was 1,000. So is it that this increase in number of the new infections, is it because of an increase in testing, or is it that the virus has permeated far and wide that it can be traced to everywhere? Thank you.
Okay. Thank you very much. Let me just respond to some of them, and then perhaps Dr. Amoth can talk to some of them, and also CS Musheru will also say something about what we are using in terms of ICT to support the same. First, Purity, on the issue of the safety of our children. The safety of our children depends on the behavior of the parents. The first line of defense of our children is the father and the mother of the child. Long before you bring in governments, long before you bring police, the first line of defense for our children is the father and the mother as a God-given responsibility. If you go to a crowded pub, you remove your mask and get into these interactions where people believe, and you know what happens when people start getting drunk in bars, for some odd reason, and I know this because I was also young once and I did it. No, it's the truth must be told. For some odd reason, people don't believe they can hear you even from a meter away. They keep on coming closer and closer, and especially then, they have got the tendency, even when they are wearing a mask, they begin to believe you can't hear them. So they pull down the mask so that they can talk to you as closely and as intimately as possible. When you do that, the chances of getting the virus, of being infected, are very high. Now, it is the same young person who has got a kid in standard 7 or standard 8 or Form 4 who is doing an exam, and you go home and your little daughter or your little son is going to jump on your lap, and you know what you are doing last night, the least you can do is avoid. But of course, nature is such that you won't do that. So you will infect your child. And it is a gross violation of the child's rights and a gross abuse of your position as a parent. Therefore, Purity, to your question, the first line of defense has to be the behavior of the parent. You know very well what's going on. So you need to observe the measures that you know can protect your child. That's number one. Number two is related also to what I think Mwangi asked in regards to the face masks. And the Ministry of Education, I'm aware, is working very hard towards ensuring that there is supply of water and so on. But not every school at the moment has it. And you know, it doesn't hurt to carry some water with you. I mean, when you were in school, we used to carry water with us every day. You know, when we were little kids, 10-year-olds, 7-year-olds, we used to carry water with us to clean ourselves. And then, on the issue of masks, I agree that there are those who the government can assist and give a mask. But surely, if you have been able to buy a uniform, and a mask is so cheap, now they are selling them at very cheap prices. We will supply what we can. But these things are even being made by tailors in the counties now. So you really cannot excuse yourself for a child not having a mask. And there is a demarcation line that ends where help stops and irresponsibility begins. There is a demarcation line pahali ambapo serikali inaweza saidia, lakini hata nyinyi mnajua kuna pahali ambapo huwezi kusema hata kutoka hapo ni serikali tu itasaidia. You cannot absolve yourself. You cannot absolve yourself of every responsibility. On the issue of testing, and it is true that our testing levels sometimes are directly dependent on the availability of the reagents that we have. Currently, we are lucky because we have reagents, and that's why we are testing at higher figures. And it is still targeted testing. We are not yet doing mass testing of everybody. We are target testing. And yes, it is also true that while the figures, we are announcing the 695 figures, are obviously as a result of increased testing, what I would really like you to wash on is the positivity rate. Because irrespective of the number, that is constant. And that, when you compare the positivity rate, you are comparing oranges with oranges, and therefore are able to tell. And when in spite of the large numbers, we are now down up to 12%. So when you get to 12%, then you have got a large number of people, then it tells you that there is serious community spread of the infections. I will let Dr. Amos talk to the current nature of the disease. And even as we do so, let us also observe another measure that is important to look at. And that is the number of persons who are going to hospitals, the number of persons who are being held in hospitals, the ones who are at home, and just the number of increases that you can see in terms of persons going to be checked in healthcare facilities. And the ultimate aim is to ensure that our health facilities are never overwhelmed. That's the key to success. Everything else notwithstanding. Mwangi Maina, you asked about the political rallies. And as I had said during my formal remarks, leadership is not just a name. Leadership is not just a position. Leadership is when you know what is happening. For example, you know there is a spread of a virus. You must take responsibility to contain the virus. When you do the opposite, then you are not leading. It is not leading. Then you are not leading. Then you become a heckler. And the point is that as political leaders, we must honestly begin to lead again. And there is no reason why the government would have to tell the leaders what to do. The leaders are the ones who should actually be telling us that because of this disease, because we can see a second wave is beginning, please stop all gatherings. We are not going to call people to rallies. We are not going to have roadside shows because we know for a fact that this is going to have an effect on fellow Kenyans. So we don't want this disease to spread so much that it begins to acquire political names for the reason why it is spread in the first place. And I think we must take responsibility and own up and appreciate that going forward, if Kenyans begin to fall in the streets, political leadership that is creating those gatherings must take responsibility and own up to that fact. The people in bars who are allowing, like the ones now I'm told in Langata Road, which we had closed a while back. Now I am told that there is even a new dance that is now the main thing in those bars. I can't remember if it's Jerusalem or something. That it is the main activity now. That once Jerusalem gets in, all measures go out. Please, can you dance Jerusalem keeping social distances? You know, nobody is stopping people from dancing, whatever it is called. But at least you can be able to dance keeping a social distance. I'm told it's not an intimate dance where you need to hold people. So, anyway. Saada, Hassan, mass testing. No, we have not yet gone into serious mass testing because of the two reasons that we give. A, it is really why it is necessary, and B, the affordability. As we have explained before, it is expensive. So we tend to look at the areas where we know we must test. For example, as kids begin to go to school, as universities open, we are discussing with the Ministry of Education so that we are also able to make ad hoc visits and tests to see whether it is spreading in those institutions. So Shantai, as we get more reagents, we test more. But we are also aware that we don't want to test to the extent that is wasteful. So let me ask Dr. Amos to respond to the other question.
Thank you, Waziri. Thank you, CS Musheru. Just to add on to the issue of the safety of children in our schools, is that we have developed protocols and guidelines together with the Ministry of Education, and we are supervising and monitoring the implementation of these protocols in school through the county health surveillance teams. But the surveillance teams are also on the lookout for any surge in number of cases in schools. So we have trigger actions that will be able to alert us if something is happening in a particular school. But of importance is also the need to shield pupils, teachers, and auxiliary staff with coexisting medical conditions to ensure that they stay safe because of that frequent interaction. Remember, this was also the reason why we had phased opening, so that we could be able to ensure that we maintain the public health social measures, including physical distancing. The severity of the disease, if you listen very carefully to Waziri's statement, the disease is severe in those who are over 58 years old, especially in our setup, even though that population fragment only accounts for about 4% of the total caseload. In terms of mortality, they account for more than 50%. So if you are more than 58 years old, you get COVID disease, you have a 50% chance of dying. Of course, notwithstanding the other risk factors, including morbid obesity, diabetes, cardiovascular diseases, and other coexisting conditions. Regarding the nature of the disease, we are monitoring very, very closely again If you go back 2 months or thereabouts, our admission rates were about 450 cases in all the institutional facilities. Today we have 991. So that figure has more than doubled in the past 2 weeks or so. That tells you that whatever is happening at the community level is that we have widespread community transmission of the disease, and more people are coming to the facilities. If you also look at critical care, we are in numbers below 10. As of today, again, we have 28 people in ICU, 10 of them under ventilatory support, 14 on supplemental oxygen, and 4 under observation. Again, telling you that we are getting more severe form of the disease. And what is also unique in this second part of the infection is that all age groups are affected. We are losing more and more people who are younger and who don't have any coexisting medical conditions. So the more the need for us to be able to take the necessary precautionary measures as we have continued to articulate. Testing has been a real challenge worldwide over, and now we'll even face more headwinds. As of today, we are in a better position to be able to test, and that is why, together with the Nairobi Metropolitan Services, we have commenced on a mass testing to be able to tell us the magnitude of the pandemic in Nairobi County. But also you remember that what is happening in the rest of the world, including Europe, more and more cases are being reported, and therefore going forward, more reagents will be required. And of course, the first world countries, because of their ability to marshal huge resources, will always get first priority. That is why in our testing we'll continue to be guided by our testing strategy, which talks of those who meet the case definition criteria, symptomatic cases, and contacts who also exhibit symptoms. Ideally, the best scenario would be if we were to test 1 person per 1,000 population. Looking at our population in Kenya, if you estimate that at 50 million, then per week we need to be doing 50,000 tests. Therefore, per day we need to do about 7,000 tests. Now with the kits that we have, we are headed that direction. That will tell us the true picture of how the pandemic is evolving at the community level. Again, in terms of the other thing that I need to emphasize on is better data collection, because we now have desk officers at the Emergency Operations Center who link directly with the counties to be able to pick up the data as soon as we get the information. Then we are able to update our line list. We can be able to provide a breakdown on the number of deaths based on at home and also the facility, but majority of our deaths have continued to occur at the facility level. But of course, if you look at our case fatality ratio, it has remained around 1.8, 1.9% compared to the global average of 3.2%, because each and every day our clinicians, our doctors, our nurses, our lab scientists continue to learn and are able to implement measures that have gone a long way in saving more lives. Thank you, Waziri.
Thank you very much, Dr. Amoth. One more thing before I hand over to my colleague, CS Mushero, is also in regards to what Mwangi had asked earlier, and I think also Shemtai, the issue of the political rallies. Let me also add one more item. And this is to say, sometimes even the citizens themselves make it very difficult for the politicians not to have those rallies. Because if a politician is driving around or getting out of a meeting and you gather around and you stop the person, the politician, from moving, you cannot really blame that person for beginning and starting to address those people. So it is not just the political class, it is also citizen responsibility to realize that as you go towards the political rally, you are exposing yourselves. So don't blame just the politician who is standing on the roof of a car and addressing you. Blame yourself also. If you are not there, they won't be there. I have never seen a politician stand in front of a Miss Shamba with nobody and then start making an address. So it is not just them, it is also the citizens who crowd around the vehicles and then make it impossible for people not to have those sort of political rallies. And I thank you and pass it over to CS Musheru.
Thank you very much, Waziri. Mine is really brief, is one, to thank the media and to thank all those that have continued to put a lot of effort in ensuring that we continue to contain this pandemic. We were hopeful that it was reducing and that we would be able to see the end of it. And unfortunately, we are seeing it actually growing, as you have actually indicated. More importantly, during the NAC meeting, or the National Emergency Response Committee meetings, the discussions we've been having is what this means. For a long time, over the 7 months, people have been asking, please open the economy. And we've been opening the economy. The president has looked at ways of ensuring that our economy continues. But if we lose this individual responsibility that we're supposed to have, then we go back to a situation where it's now between health and the economy. And health will always be the one that takes preference. So mine is really to urge Kenyans, please, please take personal responsibility for yourself and for those around you. Take care of the country, because we need both the economy as well as yourself. But the trend that we are now seeing, it's getting to a position where measures may need to be taken. And if they are, then we will end up even with more suffering. Please, media and all the people involved, don't tire. Continue with the efforts that you're putting in place. It looks like the battle is going to be bigger as we continue, and we need you to be strong. We need you to be committed as you have been, and we look forward to being able to win this battle. Please just take personal responsibility. Asanteni sana, Waziri.
Thank you very much.
Wakenya, hii fight hatukuchagua, lakini tuko na choice. Tuchague kujilinda. Tuchague kuprotect familia zetu. Tuchague usafi. Kuosha mikono. Kuosha manyumba zetu. Ndio tulinde watoto wetu. Na tuvae mask. Future yetu iko mikononi mwetu. Kenya, let's do it for the ones we love.
The Dettol range is available on Jumia. Shop safely and conveniently today.
Ah, Helen Paul.
Hello, madam. Would you like to join us on this mission?
Yes, but how?
Just one question for you. How do you keep your toilet clean?
I use regular detergent and bleach for washing and removing yellow stains. I've been using it for years.
Oh, madam, the regular detergents and bleach are used for washing clothes. To disinfect your toilet properly, you need Harpic 10X. It is specially made for germs and stains removal. Harpic's thick formula settles on stains and gives 10 times better cleaning compared to regular detergents and bleach.
Wow, now I'm convinced, Helen Paul.
Really?
Yeah.
Now that she's part of the mission, the next house is yours.
Maji mdosi wangu ametupa simu yangu ndani ya maji.
Mdosi wako kwa sawa. Venye Nkirota ameniambia ajui na akimpigia simu ashiki. Hi, guy, what that?
For the women who deserve more, Moped is now in Kenya and more than 40 countries. With its nylon-free surface, new Moped has unique softness and up to 100% protection. Your skin will love it.
Love garlic in your food but hate the hassle of making it? Introducing fresh fried garlic, specially crafted with garlic oil for healthy living. The oil has a beautiful garlic aroma and adds an extra kick when used on your favorite meals. Fresh fried garlic combines wonderfully on salads, stir fries, marination for meat, or simply when sprinkled on your favorite dish. Try fresh fried garlic today. Available in all leading outlets countrywide.
Deserve more girls. Nolly cash, nolly cash, no, nolly cash. We need a big change in our lives. Do you think this is it, girls? No, no irritation. No irritation. We need a
For the women who deserve more, Moped is now in Kenya and more than 40 countries. With its nylon-free surface, new Moped has unique softness and up to 100% protection. Your skin will love it.
Introducing Centric Courts Apartments. Cash offer at 10.5 million. Rent at 55,000 shillings, or a block of 16 units for 160 million. The first 3 cash buyers will win a car or a furnished apartment.
Maji mdosi wangu ametupa simu yangu ndani ya maji.
Mdosi wako kwa sawa. Venye Nkirota ameniambia ajui na akimpigia simu ashiki. Hi, guy, what the?
For the women who deserve more, Moped is now in Kenya and more than 40 countries. With its nylon-free surface, new Moped has unique softness and up to 100% protection. Your skin will love it.
Celebrate Mashujaa Day with Royal Mabati. We have glossy profiles at Kenya shillings 370, tiles profiles from Kenya shillings 550 countrywide, and Royal Aluzinc startup pricing at 290 for hardwares. Call us today to make your order. Free delivery countrywide with Lipa Pole Pole payment option available.
Last week, I murdered a rock, injured a stone, hospitalized a brick. Brilliant Kipchoge from Mohamed Salah. Been chopping trees. I done something new for this fight. Bad. I'm gonna show you how great I am.
Credit to you if you stay at home. If you must shop online, use your NCBA credit card. Stay home. Stay safe.
We deserve more girls. Nolly cash, nolly cash, no, nolly cash. We need a big change in our lives. Do you think this is it, girls? No irritation. No irritation. We need a
For the women who deserve more, Moped is now in Kenya and more than 40